This is the robotic system. The beauty of robotics is with the beautiful vision that we have. I put my head inside and I have beautiful 3D vision in this console. So this is the patient console. And here we have the two master slave controls. So this is what helps me to control and move the instruments of the robot at the bedside. So these are the joysticks. So I move them, and this is what is the movement of the robot in the patient. So literally this is surgery that you do and not the robot itself. It's a robot assisted surgery. So your movements of my fingers are the movements of the robotic instruments in the patient. So even as you see here, I have the control of the camera with me. I have the control of the focus. I have the control of the forearms. I have the control of the cautery, both cutting and coagulation. So everything is with surgeon's control. So there is less dependency on assistant surgeon, unlike in laparoscopy. So in robotics, surgeon is in control of most of the process, because the console, what we have for the surgeon, we have everything to be controlled from here. Maybe your joysticks here, the master slave movement, and then the camera, the fourth arm, the cautery, everything is under your control. So you can do precision surgery, more importantly, sitting in a chair. You can relax and operate to stop getting scrubbed without glass. You're able to do a more complex surgery. So this is the console of robotic system. This is Da Vinci Xi, what we use here at Yashoda High Tech City. So now we'll look at the other parts that we use, even as we look at what this robotic system is. So the robotic system has three parts. One is the surgical console. This is where I sit and operate these joysticks, which will be the movement of the robotic instruments in the patient. So the surgical console, you sit here and operate from here. So you can do a remote surgery also, telesurgery is also possible. So the first part of robotic system is the surgeon console. Now the second part, what is important is the patient cart. You have 4 robotic arms there. So these are the arms. Through small keyholes, you put a small ports in the patient, and then these arms, the instruments will be fitted into these arms, and instruments go into the abdomen, and these arms move. So instead of by hands, these 4 arms I have, which can go to difficult areas in the abdomen or in the chest and do a complex surgery. So this is the patient cart number 2. Right? First one is the surgical cart console. This is the patient cart, and now you have the vision cart. Or this is useful for the team to watch what's happening. The screen will display what's happening inside, so that the assistants and the nurses will be able to watch and see what to be done. So you have, training can be done. You can, say where to go. All this kind of markings can be done. This can be erased. So that is the beauty of this surgery, what we can do. So training can be possible. You can teach youngsters how to operate by just looking at this card and asking them to learn the technique of robotic surgery. So I mentioned 3 things: surgical console, patient cart, and vision cart. These are the 3 parts of the robotic system. Thank you.